Hey, what's going on everyone? Welcome back to the channel. My name is Dr. Vincent Esposito, and today we're going to be talking about joint pain and natural strategies you could do to kind of mitigate some of that pain. And you would think, being a chiropractor, this video wouldn't be coming out, I don't know, 3 months in or whatever. But before we get to that, if you haven't already, please subscribe to the channel. I come out with videos twice a week on everything: nutrition, wellness, health, longevity. So if you're interested in any of that stuff, please take a look at this video or other ones that might be more interesting to you. I hope they might be helpful. So joint pain is one of the and most classic symptom of osteoarthritis. Now, joint pain and osteoarthritis affects roughly 1 in 10 Americans. It's about 28 million people. And it continues to rise along with the rates of obesity that are rising in America. Joints are made up of a variety of different structures, including bones, cartilage, ligaments, muscles, and tendons. Now, specifically, a joint is where two bones articulate or move against each other or in concert with each other. And there are different types of joints. So there are 3 types of joint. The first is known as a fibrous joint, which connects two bones by means of fibrous tissue. And an example of this would be, say, like a skull suture. And these allow for very little, if any, movement at all. Then there are cartilaginous joints, or joints that are connected by fibrocartilage, which is a mixture of fibrous tissue and cartilage tissue, and hyaline cartilage. And these allow for a little bit more movement. And then there are the mobile joints known as synovial joints, where the bones are not necessarily touching at all. There's actually a joint space where there's fluid and it allows for movement. So if you think of any of our limbs, our ability to move our shoulder or hand or fingers or legs, these are all mostly synovial joints, and this is usually where a lot of that pain comes from. One of the main reasons that we end up with joint pain, especially in osteoarthritis, is because one of those tissues, whether it's cartilage or bone or ligament, begins to falter over time, and this could lead to pain in that specific joint. Now, some of the risk factors associated with osteoarthritis include how old we are, obesity, injury or trauma to the area, a genetic predisposition, poor joint loading over time, so repetitive motion with poor biomechanics, or being female, as after menopause, a lack of estrogens might lead to bone demineralization. Now, some of the symptoms associated with osteoarthritis include joint pain or stiffness, lack of mobility, fluid or crepitus, which is sort of like a popping you hear when you move in the area. These are all signs and symptoms of osteoarthritis. Now, unfortunately, there is no cure for osteoarthritis, but there are some lifestyle modifications and analgesics you can use to improve upon those symptoms associated with OA. Conventionally, the approach to joint pain usually includes a form of NSAIDs or corticosteroid injections. Now, over time, these come with side effects and could leave the joint in question in worse shape than before due to the breakdown of the tissue around where the injection took place. This could lead to a worse outcome in the long run, and the goal of this video is to provide some other alternatives that come without those side effects. So let's get into that. So the pain associated with OA is usually due to inflammation of some sort. So a great place to start, given the pace of this channel, is to avoid and eliminate a lot of those inflammatory foods. So processed and refined foods, excessive simple carbohydrates and processed sugars, conventional dairy, soy, corn. Anything that might be a food intolerance is something really smart to avoid, as these could exacerbate some of those pain symptoms. Conventionally raised meat and dairy also can contain inflammatory markers that could make your pain worse. So ideally, getting rid of these and the foods I mentioned before would be a great place to start in terms of reducing your pain. With that said, incorporating more green leafy vegetables, fruits and vegetables of all different colors, so you get the wide array of phytochemicals available and also inflammatory compounds associated with them, will decrease the inflammation as well as the production of inflammatory compounds like interleukin-6 that can lead to some of that pain and triggering that inflammatory process. Additionally, getting more omega-3 fatty acids would be ideal as well, and balancing that omega-3, omega-6 ratio will again help dampen that inflammatory process and hopefully get rid of some of that pain. In terms of supplements that might be helpful for joint pain, a good place to start would be something like turmeric or its active component curcumin. These are known to be highly anti-inflammatory. The caveat with turmeric in general is that it's very poorly absorbed, so it's not readily bioavailable. So one of the tricks to improve that is to take it either in your food, add black pepper to it, or if you wish to take it in supplement form, make sure that supplement also contains black pepper. So it's really key because it has very highly anti-inflammatory compounds if you're able to absorb them in the first place. Chondroitin sulfate might also be something that you might want to consider. Now, it allows for maximum stability and flexibility of cartilaginous tissue, which is key to keeping joint integrity. Some studies have found using chondroitin sulfate can increase joint mobility, decrease pain, and this is thought to be due to suppressing inflammatory mediators and inhibiting collagen breakdown in the joint, while also providing more material to keep that cartilaginous matrix of the joint intact. Glucosamine sulfate is another naturally occurring GAG in the body that is very helpful and could be useful for those with joint pain. It is a building block for cartilage tissue and also synovial fluid, both of which help reduce friction in the joint, which can inhibit its ability to break down as quickly. So allowing for more frictionless movement will increase the joint's ability to function properly for longer. One study also suggests that taking chondroitin sulfate along with glucosamine sulfate in addition to it was more effective than taking either one of them separately. So something that might be worthwhile. Another supplement that might be worth considering is collagen, because it includes both glucosamine sulfate and chondroitin sulfate, as well as provides the body with some of the resources it needs to rebuild and stabilize that joint versus allowing it to degrade more quickly. So it could limit the damaging process. In addition, collagen also contains hyaluronic acid, which is used in the synovial fluid to again promote proper joint motion and reduce that friction between two surfaces. All in all, collagen is a great choice to help strengthen cartilage, ligaments, and tendons that all aid in joint mobilization and proper movement. Additionally, vitamin D is associated with proper bone and joint health. The best way to check this is to simply go to your doctor's office and see if you're vitamin D deficient. If you happen to be somewhere in that 50 to 80 range, then that's considered optimal. If you're below it, you might want to consider a vitamin D supplement to help get you into that optimal range. Finally, I alluded to this earlier, but omega-3 fatty acids could be useful in eliminating or minimizing some of that joint pain because of its anti-inflammatory compounds. The caveat to this is if you happen to be taking some sort of blood thinner or something like Coumadin, you might want to stay away from this because it could really affect the body's ability to form clots when it actually needs to. So that's something to keep aware, and again, something you should bring up with your doctor before you do on your own. Ideally, you would also want to be getting your omega-3s from foods, or more importantly, decreasing the amount of omega-6 fatty acids you're getting from your foods, which plays just as pivotal a role. Additionally, low impact exercise, stretching, and proper strength training without causing more excess or dysfunctional loading of the joint will help with its overall health, along with that anti-inflammatory diet. Additionally, how you think about pain and how you associate it with your health overall really plays a key role, and we actually did a podcast episode on psychosocial effects of pain, and I will link that below if you're interested in learning more about that. Finally, getting proper amounts of water is key. It allows for joints to be properly hydrated, as well as the muscles, ligaments, tendons, and cartilage to be properly hydrated as well and function as smoothly as possible. So I hope you found this information helpful today. Again, if you have joint pain, I'd suggest trying one of these strategies out. If you have any questions about potential supplements, I'm happy to answer them in the comment section below. So if you're interested, let's meet there and have a discussion. Again, so if you like this video, if you like the information, please like and subscribe below Really appreciate it. Again, coming out with videos twice a week. And if you have any questions, please feel free to reach out. And until then, take care.